There have been several attempts to pass a law in Massachusetts that would allow terminally ill patients to end their life with the help of medication prescribed by a physician. Opponents call it assisted suicide, while supporters call it death with dignity. And those supporters, like John Berkowitz, director of Western Mass Death with Dignity, and Dr. Douglas Barnshaw, are hopeful a law currently in committee might be passed sometime next year. They spoke with me recently and offered their perspective.
I just feel so strongly about it. I'll just give it illustrated with a couple of reasons. There's another physician, in addition to Dr. Barnshaw, who does not have Zoom. He's 97 years old. His name is Dr. Tito Gambarini. He lives in East Hampton, and he feels strongly about this issue because he watched his wife die of pancreatic cancer some years ago, just not long, 6, 7, 8 years ago. And he knows that his end is coming soon, and he would like the option to have a peaceful and painless death and not go with uncontrolled pain at the end. And I would like that too. I'm 73 in good health, but one never knows what's going to come in life. So I'm fighting for this option for myself, for Dr. Gambarini, and for plenty of other people all over this country and this state.
Dr. Barnshaw, for you, as I understand it, you have a rare heart condition. You are in hospice care at the moment. When you looked at this issue, why did you decide that this was an option that you wanted for yourself and you wanted to support?
Well, I've been a supporter of compassionate care for years, recognizing that I think people should have the option to choose at the end of their life, just like John said. And then additional motivation came when I came down with an incurable heart disease and not just knowing how my end might come. I'd like to have this option to die with dignity, and I'd like to have it for everybody else who may get into a similar situation. Now, most situations can be controlled through hospice or other care, their physician, but not all. So it eases one's anxiety to have this option. And in my understanding, in other states where it exists, most people don't use it, but it eases their anxiety. So I think it's a medically sound option to have available.
John, in terms of specifics of this legislation, I know that opponents talk about it as assisted suicide. Supporters such as yourself refer to it as death with dignity. For those opponents who consider this suicide, what would you say to them?
I would say that this is not suicide. This is not assisted suicide. This is assisted dying, because people who commit suicide don't want to live anymore because they are just that depressed or that desperate. People who want the option of death with dignity or medical aid in dying, they want to live. They just have terminal illness. They have 6 months or less to live, and the disease will not give them that option. They want to live, but they're going to die. They just want to be able to control how they die. And if the pain and suffering becomes just too great, and hospice palliative care, for all its wonderful services for many people, the majority of people, but there's a significant minority where the pain just isn't managed, the suffering cannot be relieved, and that's when people really rely. In the states that have passed this, they know that they could have a peaceful and painless death and avoid the worst of the worst. It's not just for themselves, but for their caregivers, their loved ones who are witnessing that suffering.
You mentioned states that have passed this. This measure was something that began years ago in Oregon and Washington states, but in recent years we've seen Vermont and even Maine pass this in terms of neighboring states. Dr. Barnshaw, I want to call attention to something that you wrote, a piece that you wrote about your support for this measure. It was on the Death with Dignity website, and it said, in part, quote, "I'm a retired physician and know well how pain and suffering can lead to emotional distress among patients and their family members." What have you observed?
With people with chronic pain that cannot be relieved by medications, as you can imagine, that's very distressful. for them and very distressful for their family members that are witnessing it. So I would agree with John that this measure is not only for the patient's benefit, but for the family and friends who are witnessing this.
John, what about people who are listening to this and say, you know, as I understand it, the way the bill works is a physician would prescribe medication that would help a person end their life, and then it could be taken by that person, or perhaps they might wait or change their mind. So that could open up an area where someone else, the medication could fall into the wrong hands. You know, what safeguards are in place in this proposed law?
Sure, Carrie. I just want to clarify one thing. That if a person has chronic pain, that doesn't necessarily qualify them to in spite of how much suffering there might be involved. That's not something they could go to the doctor for if we pass this law here and say, I've just had enough of life, you know, I'm in chronic pain. That's not what this law is designed for. That person has to have been suffering from chronic pain for a long time, but also have a terminal illness, a diagnosed terminal illness, cancer, heart disease, whatever it might be. Only then, with 6 months or less to live, can that person with chronic pain become eligible and qualify and receive the medication from their prescribing doctor, and then from a pharmacist. And I just want to add, any doctor and any pharmacist can also refuse to participate because whatever, they don't feel comfortable with it. It doesn't meet their religious or ethical values. But I would say the majority of doctors in this country and the state now are showing that some of them are open and they would be willing. If a patient comes and says, I'd like to have this option, they'd like to have the option of counseling them and perhaps even prescribing to their patients this medication.
But specifically to the issue of safeguards, what safeguards are in place?
This medication, most people, I think it's 95% of people are in hospice care at home or in a residential hospice program or in the hospital. So there's a lot of monitoring of medications by nurses, by doctors who are supervising all of that. And the medication is, and then there's a safe disposal law, you know, in the state. Lots of people who die, whether they have, you know, without this law being passed, they have medications in the cabinet. They must be safely disposed. That's what hospice, that's what doctors, that's what nurses monitor and keep an eye out for. And they help families dispose of them legally. So that's one safeguard. But the other ones are really, you know, for how do you qualify so that someone isn't kind of, you know, slipping through the cracks and they're really not qualified. So there's a process here. By the way, I'll just say, this is not for a COVID-19 patient who is suddenly in a week or two or three, you know, overwhelmed with this disease and they're on a ventilator and they're struggling for life and they're really not even able to make their own healthcare decisions, particularly at that point in time. No, this is more of a deliberative process where if you're terminally ill, your doctor, you have to wait 2 weeks, go to another doctor who has to confirm the diagnosis of the first doctor, 2 weeks apart. So that gives you the patient a chance to kind of think about it. Do I really want to go through with this? You have an appointment with a second doctor. They confirm the diagnosis. Our bill in this state adds another step. Then you have to have a separate meeting with a qualified mental health professional. Not necessarily a psychiatrist, but at least a psychologist or a clinical licensed social worker, whatever. And that person, that professional has to verify that you are not clinically depressed, that you are not under duress or coercion from a family member to do something that you maybe don't want to do, and that you're really cognitively able to make a rational decision about this important choice at the end of life. So those are some of the safeguards built in. It takes a while. It takes maybe 5-6 weeks if you were really, you know, going to qualify for this, and only then can you go to a pharmacy and get a prescription filled that your doctor wrote for you, that you're qualified.
Well, currently this bill is in committee. John, just briefly, this isn't the first time this issue has come up in Massachusetts. There was a ballot question. It narrowly was defeated. What's your take on where this might go from here?
There is really a good chance that Massachusetts could become the 10th state to legalize a death with dignity option for people. So we really urge the public that supports this, get in touch with, you can find it on our website, so all the information is there. Get in touch with the Healthcare Financing Committee. That's the second committee that's got it right now. They have until July 31st. We would like them to pass it. If they do, that's 2 committees that have passed it. And we think that perhaps in the fall, the legislature can finish and pass it completely. The governor would sign it. Hopefully, we don't know that for sure. We hope so. It becomes law.